Garcia, and this time we'll be talking about Ebola virus disease. Ebola virus disease is also known as EVD, or Ebola hemorrhagic fever, or EHF. It is a viral hemorrhagic fever of human, and it is rare but severe, often fatal in humans. Ebola virus disease is caused by 4 out of 5 viruses in the genus Ebola virus, family Filoviridae, order of Mononegavirales. The 4 diseases causing the disease in human are as follows. We have the Bundibugyo Ebola virus. Okay, and then we have the Zaire Ebola virus, or the Ebola virus, Sudan Ebola virus, and Thai Forest Ebola virus. What do we notice about these names of Ebola viruses? It is named after the location where they are actually discovered. Okay, they are Ebola virus and its genus were both originally named for Zaire, now known as Democratic Republic of Congo, because they have been identified as Ebola area, the country where the disease was first described. Ebola virus carries a negative sense RNA genome in virions that are cylindrical or tubular. So take a look at this picture over here. And contain viral envelope matrix nucleocapsid component. The overall cylinders are generally approximately 8 nanometer in diameter and have virally encoded glycoprotein projecting 5 to 10 nanometer long spikes from its lipid bilayer surface. The natural reservoir of Ebola virus is believed to be the bats, particularly the fruit bats. The fifth virus is called the Reston Ebola virus. It is known to cause disease among non-human primates like monkey, gorillas, and chimpanzees. The mode of transmission of Ebola virus, it is believed that the primary source of infection is transmitted from animal to human. The virus is zoonotic, animal-borne, with bats being the most likely reservoir of the infection. The secondary source of infection, the virus can be transmitted from human to human. Direct contact with infected person with their body fluids such as blood, sweat, saliva, semen, or other body discharges of an infected person. The Ebola virus has been detected in the breast milk, urine, and also in semen in convalescent male. The virus can persist in semen for at least 70 days. So if we will try to recall, you can be carrier for 70 days, where in fact you're no longer manifesting the signs and symptoms. And how we call it nga? We call it the convalescent stage. One study suggests persistence for more than 90 days is also observed. Saliva and tears may also carry some risk. Another way by which we can contract Ebola is by indirect contact. The Ebola can be transmitted indirectly by contact with previously contaminated surfaces and objects. Exposure to objects like needles that have been contaminated with infected person. That's why one of the most common infected individual of Ebola virus are the healthcare providers. The dead body of an infected person can also be the source of infection. Okay, Ebola cannot be transmitted through air, so it's not an airborne. It can be transmitted through water. It cannot be transmitted through food. Okay, so remember all those things. Okay, so you cannot get it by air, water, and nor with food. Now, how do we diagnose Ebola virus? We have what we call the polymerase chain reaction, which is one of the most commonly used diagnostic method because of its ability to detect low levels of Ebola virus. PCR method can detect the presence of a few virus particles in small amount of blood, but the ability to detect the virus increases the amount of virus increases during the active stage of infection. When the virus is no longer present in great enough numbers in patients' blood, PCR method may no longer be effective. Other methods based on detection of antibody of Ebola virus case produces to an infection can be used to confirm patient's exposure and infection by Ebola virus. Antibody capture enzyme link immunosorbent assay or your ELISA, an antigen detection test. Another one is virus isolation by cell culture. So we have discussed that before, that when we do the culture, we'll be able to see what specific microorganism is infecting the individual. And another one is electron microscopy, wherein we visualize the microscopic characteristic of the microorganism. So what are the signs and symptoms of Ebola virus? Symptoms may appear anywhere from 2 to 21 days after contact with infected individual or with the virus, with an average of about 8 to 10 days. This course of illness typically progresses from dry symptoms initially with the fever, aches and pains such as severe headache, muscle and joint pain, abdominal pain, weakness, and fatigue. And then it usually progresses to wet symptoms such as diarrhea and vomiting. As the persons become sicker, okay, primary signs and symptoms of Ebola virus often include some or several of the following dry symptoms and wet symptoms like abdominal pain and unexplained hemorrhaging and bleeding or bruising. Other symptoms may also include red eyes, skin rashes, hiccups. Many common illnesses can have the same symptoms as EVD, including flu, malaria, and typhoid. That is why sometimes they are mistaken as this kind of diseases. EVD is a rare disease but severe and often deadly disease. Recovery from EVD depends on good supportive clinical care and patient's immune response. Studies have shown that virus of Ebola infection have antibodies, proteins made by immune system that identify and neutralizes invading viruses that can be detected in the blood up to 10 years after recovery, and that's one good news. Survivors are thought to have some protective immunity to the type of Ebola that sickened them. However, as mentioned earlier, we have 4 out of 5 viruses that may produce Ebola virus disease. Now, as nurses, how do we care for these people? First, they usually have this complaint of pain. So one is acute pain related to abdominal, headache, muscle or joint pain. They also have loss of appetite, so they have activity intolerance and reduction of fluid and electrolytes. They have hyperthermia, and that is due to the successful invasion of microorganisms in the body produced by prostaglandin. And there is risk for imbalanced nutrition because they have loss of appetite. They also have deficient knowledge about management of Ebola and the fluid volume electrolyte imbalances related to vomiting and LPM. So basically, as we deal with these people, we manage them, we give intervention according to the nursing diagnoses that we have identified. So let's say we're talking about muscle pain, so we give them relaxation techniques, we give them uh, rest in between activities, and then we also give some pain management, diversional activities and the like. Now, doctors may also provide certain pharmacological pain management. And for fever as well, we provide TSB, increasing fluid intake, and loosening the cloth, and then providing environmental temperature control. And we can also provide pharmacological management by administering paracetamol as ordered by the doctor. And then we can do hydration for our patients who have LBM and vomiting. So if the patient is vomiting, obviously we cannot induce increased fluid intake. So we can just resort to intravenous hydration as per doctor's order. So management will be dependent on the signs and symptoms presented by the client. Now, for the pharmacologic management, there is no vaccine for Ebola virus up to this time, and there is no specific treatment for the disease. The standard treatment for Ebola virus includes intensive supportive therapy, balancing the patient's fluid and electrolytes, maintaining their oxygen status and blood pressure, treating them with other possible complications of infection. So basically, whatever the manifestation is, that would be the pharmacologic or the medical management. So that is what we call the intensive supportive care for patients with Ebola virus. Okay, so thank you very much. See you on my next lecture.